Following decades of medical breakthroughs and gains, childhood vaccination rates are steadily dropping around the world, including here in Canada. A new study published in The Lancet found vaccinations against diseases like measles and polio slowed down between 2010 and 2019. But between 2020 and 2023, more than 15 million children were missing routine shots. And this comes as Canada is seeing a sharp increase in measles cases after years without a single case. So for better understanding this morning, we're joined once again by Dr. Bogoch, infectious disease specialist. Good morning.
Good morning, Henry.
Let's pull this focus out a little bit. The global trend started more than a decade. So why have childhood vaccine rates been declining for this long?
Okay, I mean, it's obviously very complicated, but essentially, there's issues with access to vaccines and then issues with people who do have access to vaccines choosing to accept a vaccine when it's provided in front of them. And there's likely many reasons, but I know many people think this is all COVID related. And as you correctly pointed out, this trend started, especially in high-income countries, long before COVID. We're dealing with a lot of misinformation and disinformation surrounding vaccinations, such that when people are presented with this option, they're choosing not to get one. And as you also point out, Canada's in the midst of a large measles outbreak. Not too long ago, we had a large pertussis, a whooping cough outbreak. So these events have real world negative consequences, not just in other parts of the world, but also here in Canada.
Yeah, and around the world, when you look at, there's more than 100 conflicts that are happening globally, then there's access, there's war, there's famine, there's climate reasons that those vaccines can't make it to certain childhood populations. But here in Canada, we know that a lot of kids missed routine vaccinations during the pandemic. They just either couldn't get to them or they'd get sick and have to cancel appointments. But this study pointed out something interesting, that vaccine rates have not returned to the pre-pandemic levels. Why do you think that is? What are you hearing in your office?
Yeah, I mean, this is obviously very problematic, and they certainly haven't. If you look in Canada, it's a bit of a patchwork. Some places have very, very high rates of vaccinations. Other pockets in the country have lower rates of vaccinations, as low as 70 or even lower percent for routine childhood immunizations. And we know with an illness, for example, something like measles, which is so transmissible, if a virus like that enters one of these under-vaccinated pockets, it's going to take off like wildfire. And that's exactly what we're seeing happen right now. And this is a combination of pandemic-related disruptions. This is a combination of people not having the easiest access to primary care or public health clinics that provide vaccines. We know many people don't have a family doctor, or even if they do, they might struggle to reach their family doctor. We know that, so we can call those barriers to vaccines. And then we also have to consider, people who have now mistrust the public health infrastructure and public health personnel for a variety of reasons. One of many reasons might be related to the pandemic and related to some misinformation and disinformation that was amplified during the pandemic. But I think we also have to acknowledge, there were significant times during the pandemic where policies were, not really aligned with reality. And people said, well, this doesn't make any sense. And there was a lot of mistrust, unfortunately, generated through that. I think it's going to take a lot of effort to rebuild public trust in public health, but it's definitely a battle worth fighting for. We need to get our vaccine rates up. These are all preventable illnesses.
Yeah, we've been talking about this, and we've been looking at it in media for a while now, but these are the numbers that surprise me. 95% vaccination is what you need for herd immunity, if I have that right. But we are seeing rates as low as, like in the measles, for example, where you need a double shot, as low as 76% of people, way below what we need for herd immunity. That is in part feeding this dramatic increase that we've been seeing in measles cases recently. And just to give everyone some more numbers, this year alone, more than 3,300 cases have been supported. So how quickly does this disease spread, and what are the dangers if it does?
The measles spreads very, very quickly. I think the other issue, too, is when you're seeing measles outbreaks, it raises a bit of a red flag. This is the canary in the coal mine. It also is a demonstration that there might be other public health initiatives that are lagging, and measles is just explosive and visible, and it's the first one you're going to see. So you also have to watch out for other public health programs. But measles is probably the most transmissible viral infection on the planet. It spreads very, very quickly if it's introduced. This is not just a Canadian issue. This is a global issue. There's a massive global resurgence, not just of measles, but of other vaccine preventable illnesses. We have the tools. We have the capabilities. And the real question is, do we have the will to double down our efforts on lowering barriers to vaccinations, providing sound communication and high caliber information to people such that they can make smart choices when these are provided to them or their families? And I think it's well worth the effort to do so.
Dr. Bogoch, just a quick question around that issue of herd immunity. We are heading into summer camp season. There's either family gatherings or kids are going to be in close quarters for months at a time. Given the fact that herd immunity rates are dropping, can you give us a sense of what happens if you are vaccinated with one dose, you haven't had your second yet, and you go into an environment where there is a measles outbreak? What's your protection?
I think it's important to remember that a single dose of measles vaccine is extraordinarily effective, like over 90% effective in preventing the risk of measles. 2 doses is better. But if you look at the outbreak in Canada, for example, right now, and especially if you look at children and adolescents and young adults, the risk of infection in those who have had 1 or 2 doses of a vaccine is negligible. Okay, no vaccine, no intervention is 100% perfect 100% of the time. But wow, is this one extraordinarily effective. And again, the risk in a young adult or an adolescent is negligible if they've had 1 or 2 doses of a measles vaccine. Yes, it's a 2-dose vaccine. It's a routine childhood immunization with the first dose given at the first year of life, the second dose given at around 4 to 6 years of age before a child enters school. But some people might have missed it and are catching up. But again, the kids who are going to summer camps who are vaccinated, the risk is minimal.
And really quickly, for elder millennials and Gen Xers who may not realize they need to up their measles shots, how can they find out if they need to do so?
The best thing to do is you got to speak with a healthcare provider. There's no one-size-fits-all approach. You could talk to a doctor, a nurse practitioner, a public health specialist, a pharmacist. You might not have your yellow card that's rotting away in a top drawer somewhere in a house you lived in 40 years ago. So go speak with a healthcare provider to see what the best approach is for you if you're not sure if you've had a second dose.
Dr. Isaac Bogoch, always great to have you here. Happy Canada Day. Thanks for your time.
Thanks, Henry. Happy Canada Day to you too soon.